Okay, good afternoon, everyone. It is now 1 o'clock, and I want to call this meeting to order. And we'll start off with the roll call here. Councillor Foster, here.
Present.
Thank you. Councillor Van Leeuwen, present. Councillor McElwain,
Present.
present. Councillor Kittredge,
Present.
present. Councillor Dunsmore,
Present.
Councillor McCrae.
Present.
Okay, we are all here. So before we get into the meeting, a really sad news came out of our community with Paul Walker passing away. Paul Walker has been in the community for so many years. Most recently, he was the president of the Grand River Agricultural Society. He is a long-standing member of Economic Development Task Force. He chaired the task force from 2014 to 2018, and he was the vice chair since 2018. This is very sad news, and Paul will be greatly missed by all of us. And our thoughts and prayers go to his family and his friends at this difficult time. So I'd like us to take a 30-second time of silence to remember Paul. Thank you, members of council. Also, before we started, I also wanted to congratulate Councillor Dunsmore for reaching Ottawa. He didn't take the fastest route there, but thanks so much for doing that, Councillor Dunsmore. Supporting the Cody Shepherd Project and mental health in our community. Steps to stop the silence. Thanks so much for doing that. 500 kilometers from here to Ottawa. That's not a short little walk. So thanks for doing that. Thanks for making us proud at council and supporting such an amazing cause. It was really good that Senator Black was able to walk with you the last 5 kilometers. So thanks for supporting this community as well, Senator Black. And let's all take ourselves off mute for a couple minutes, or not a couple minutes, that would be way too long. 30 seconds and thank Councillor Dunsmore.
Thank you, Kelly. And I just want to give a big shout out to everybody in the community who donated, and particularly the people that tweeted and texted and posted on Facebook on the days that were getting difficult for me. Their words did not fall on deaf ears, and they actually pushed me up a fair number of hills. So I want to express my appreciation for the community for getting behind this project, and to my fellow members of council who supported me. Thank you very much.
Thanks, Councillor Dunsmore. How is the knee? Are you okay?
Knee's ready to come off. I'm going to send an email to the surgeon at the end of the month and say, get me on the list, but I hear the wait's about 2 years. So it's actually feeling better than it has in years. But, you know, you still wake up in the middle of the night. It reminds you that it's not right. So, but we'll get there.
Oh, that's good. Okay, disclosure of pecuniary interest with anything on the agenda under the Municipal Conflict of Interest Act. Okay, seeing none. The first, we have a presentation by Dr. Nicola Mercer, and she's a medical officer of health and the CEO for Wellington, Dufferin-Guelph Public Health. So it's really a pleasure for us to welcome Dr. Mercer here today. I know, Dr. Mercer, your time is very valuable, but we really appreciate you taking time out to talk to councillors. I thought it would be very important for councillors to have direct opportunity to ask you questions and have you talk to them directly. And, you know, Dr. Mercer, you've been really great from a county perspective, being on our weekly calls all the time. And on our Mercer calls, we've always had access to your expertise. So thanks so much for your leadership throughout this very difficult COVID pandemic. And thanks so much for coming here today. So the purpose of Dr. Mercer being here is just to go through some of her thoughts on the COVID and specifically the mandatory mask order, and to give counselors an opportunity to ask a question from Dr. Mercer. We probably could keep you here all day, but we don't want to do that. So after we're done, feel free to leave the call. But thanks for your time, and I'm going to turn things over to you right now. Welcome, Dr. Mercer.
Oh, thank you very much, and thank you everyone for having me today. Now I'm going to try and share my screen, so let's hope that this works. So just give me a chance here. First of all, can you see that? If people can, I can see you, Carrie. Okay, so that's great. I'm just going to go into slideshow mode. So. All right, so let's just hope that this moves along. So thank you very much. And I was asked a few specific questions, but I thought I would just walk us back a little bit, just to provide us some context to answer the questions specifically that council had asked of me. So this may be familiar to you, but if not, you can get this from the Ministry of Health's website, and I pulled this off on Friday, so there's actually some substantial increases that have occurred over the weekend, but what you can see here should clearly, it demonstrates that we are potentially entering a second wave, and I use the word potentially because really waves occur retroactively. So we look at the numbers and we're able to see them in hindsight, and you can really easily see the first wave and now, and you can see how high it came, and you can see when it started to decline. So really around the very end of April was when we were hitting our peak, and you could see that we never actually were hitting more than about 700 cases a day, and that's what we peaked at. Now, remembering that when we did that, we actually had a very proportionately much fewer testing being done in Ontario, so that that peak might have been an underestimate. But the peak was very different, and who was getting it back then. So looking at what this is, and you know that over the weekend we came very close to 500, so we're not that far off right now, the second wave and the peak of the first wave. So I will talk more about that. So moving on, well, actually, I don't know how I can remove. Anyways, I have all of you lot in front of my screen here, so I hope you don't have that, because to the far right, there is the graph for Wellington, Dufferin-Guelph, and this is cases by health unit and rates. So I hope you can see that, and what I've sort of highlighted on my screen here. I don't know if you can see my mouse. Is my pointer? Yes. Okay. Thanks, Carrie, for giving that to me. So for those of you, hopefully you can see where my pointer is. And there are very few health units actually that have higher rates of COVID than Wellington, Dufferin-Guelph. There are actually 6. And we have consistently ranked, if there's 34 health units in the province, soon to be very, very close to being 33, but we have consistently ranked in the top 25% of health units for numbers of cases, which you may not realize. And this week will be higher for us. I've been looking at the rates per 100,000, and we're definitely creeping up. Next screen. And this, I get asked a question all the time. So who gets it? So in the first wave, we really were looking at this age group here, all of the dark orange. That's what we saw. And if you look at our website, you'll still see that the rates in this age group are the highest, but rapidly changing. And the reason why is because of, at first, all of our cases occurred predominantly in healthcare workers and our long-term care and retirement homes. I hope that we don't see a resurgence of the long-term care retirement home cases, but the age group now, which is dominant, oops, let me just go back, sorry about that. The age group now, which is dominant, is our young adult population, the 20 to 29-year-olds. Fully 19% of all cases to date have been in this age group. And if you combine it with the 30 to 39-year-olds, you will see that almost a third of our cases, or about a third of our cases, are in the young adult population. And this has some significant, because this is driving some changes in what we're seeing in the healthcare system, and potentially a much more worrying trend for the second wave. So this is our challenge. What we find is that at least 95% of our population is currently susceptible to this virus. If we don't do something about the transmission of the cases, we are going to see a wave that will probably look substantially worse for our second wave than what did for our first wave. It does have the potential to overwhelm our healthcare capacity with some caveats. So you're saying, okay, well, why aren't we seeing patients in hospital right now? And the reason is because it is circulating predominantly in that age group, 20 to 39. But if you get enough of that age group, 20 to 39, then it doesn't take very much for them to give it to their parents and their grandparents. And when we get in that age group, that's when you begin to see the healthcare utilization go way up. There's still a lot that we're learning about this virus, but it is highly infectious. And what we know about who's been infected is probably only the tip of the iceberg. I get people ask me frequently about, asymptomatic transmission. It's very hard to know that number, especially when we don't have a very good serological test. That's a blood test right now to know. But estimates are 20 to 40%, probably a bit closer to 20% than 40% of cases are truly asymptomatic. We know, as according to the first wave, that widespread restrictions, lockdown, are effective. We know that because this disease predominantly spreads person to person, but it's not sustainable. And it had a huge, large economic impact that's still with us today, and it had a huge human impact. People being isolated and uncertainty, mental health, losing their jobs. We know we need a vaccine. It is at least 12 months away. Okay, at least. So even if we get a vaccine and we have news of it, the ability to distribute it and who gets it first and how much are we going to get first as a country? Will we get it all? Probably not. And so those are really very worrying challenges about even when we get the vaccine. So the question that we have to ask all of us as public health officials, as our municipal leadership, how do we maintain existing restrictions without prompting a resurgence requiring another lockdown? So this is how I like to see it. So when we entered stage 2, we were able to keep a balance. So we had the transmission within the population over here, and it was balanced by the things that we were doing to keep it at bay. So we didn't eliminate it. We just kept it kind of at a balance so that we were able to manage the number of people. We weren't getting more cases, but we actually weren't getting a lot fewer cases. It was still, we still had rates of, in our community, and they were pretty stable for the months of July and August, quite stable actually. And this was based on, we had quite a few closures in stage 2, which meant that we had very limited social contact. We did a lot of testing and case and contact management. That's where we began to ramp up. We had a quarantine for travelers. Everybody was practicing physical distancing and hand hygiene. So as we entered stage 3, this is when things began to change. This is when we provided an opportunity for increased social contacts. So at that time, when we entered stage 3, there was a need to mitigate this with, so we know people are going to have more contacts. So we had to come up with either new or increased interventions to try and reduce transmission. So we had to do more testing. So our testing ramped up substantially. We were doing, maybe 5 to 10,000 cases per day of testing. Now we're closer to 50 to 60,000 cases, and the Premier wants to take that up to 100,000 cases per day. So really huge amounts of testing were happening in our community. Case and contact management. So the teams, whereas if you'd have looked at my case and contact management team for diseases back in January of 2020, I had under 20 people who were doing that. My numbers now are closer to 75 to 80 people doing this, with the capacity to go up to probably our maximum capacity is just over 100 right now, based on the staff that I have who have the skills to do this. And we introduced masks, which I will speak about more towards the end of this. So when we opened the venues, they pose less risk of the transmission compared to what we wear in our pre-COVID situation, meaning that as we opened this time, we actually knew a little bit more. So we kept people distance, we put in engineering barriers, we sort of had policies and procedures, and of course we had our PPE. So this is what we thought of when we entered stage 3. But as you saw, the big thing that happened with stage 3 was this. We had increased social contacts, and this disease goes person to person. Our measures over here on this side, testing, case of contact, traveler quarantine was still in place, but physical distancing and closures became less dominant. We still had hand hygiene, but people weren't doing this as much. So what we attempted to do with the use of face masks and increased physical distancing and increased case and contact management is this. We try to, again, we're going to have more social contacts, more people are socializing, more families are getting together. Can we keep a balance with all of these things, the current interventions of what is happening? Unfortunately, this is what we want. We want the vaccine. We want to be able to defeat COVID if the vaccine occurs. But what I'm seeing, I'm going back to this slide, is we're not in a balance anymore. If this begins to drive our transmission, and this is what we are seeing the weight of our social contacts right here is actually outstripping all of the things that we are doing to try and control this virus. So it's beginning to show up with increasing numbers of cases. And that just means that on this side, it's the testing and case and contact management. We're having a harder time keeping up because people, when we talk to them, they could tell us that they have 30 or 50 contacts. That becomes very challenging. Sometimes they don't even remember how many contacts they've had because they've just had too many. The traveler quarantine is still in place. This is people are getting COVID fatigue. They are not practicing physical distancing. People are getting grumpy about wearing face masks, washing their hands. So this is all showing if people don't do this, then this is going to win. So as I've talked about, this is spread person to person. It is not as much about things as it is about people. So people find it much easier to contemplate, well, if I just keep, we just got to do cleaning. We just have to do more cleaning, wipe more doorknobs. Yeah, that's help. But I tell you right now, this is not about the doorknobs in our lives. It is about the people in our lives. And the respiratory droplets, even as I'm speaking right now, or as you are all quietly breathing, your respiratory droplets are landing in a circle about 6 feet around you. Now, some things can make those respiratory droplets go further. Fans, coughing, sneezing, singing, shouting, or projecting one's voice if you're standing at a podium. These are all circumstances when those respiratory droplets don't go 6 feet, they actually go further. But the most important thing, if you remember anything about how this droplet is spread, it's about that conversations, it's about those social situations where we are together in a room talking to people. That's what these are, the 3 C's. So these are the situations that pretty much guarantee, if you have put somebody in a circumstance that's got COVID, pretty much guarantee that everybody in this circumstance or a lot of people will get COVID. So closed spaces with poor ventilation. So office meeting rooms, staff rooms, lunch rooms. We still see this. We still see that if our workplace outbreaks are almost all circumstances where people, yes, they're wearing their masks when they're out in front of the public, but as soon as they go into the lunchroom, they're going to have their break, they take off their masks, they're sitting there, they're chatting with their coworkers, and we've had a number, not just 1 or 2, we've had a fairly substantial number of outbreaks in our, we've had it in our hospitals, we've had it in our long-term care homes, we've had it in our businesses, we've had it in restaurants, behind the scenes. So this is a really important one for you to keep in mind as counselors as to one of the most dangerous environments. Crowded places. This is our nightclubs. This is our young adults, packing 100 people in a backyard or 50 people in a house, crowded places, and close contact settings. So you don't actually have to be in a closed place or a crowded place. You just need to have a conversation with a coworker in a hallway for 10 to 15 minutes, and if that coworker is positive for COVID and you are not wearing a mask, then again you could contact COVID. So this is very important because all of the interventions that we do are based on trying to mitigate these 3 things. So if you're an individual, what can you do? Well, physical distancing makes sense now. You have to stay further apart from people when you spend time with people. You need to limit your social circle. So by that I mean, we don't want you to have no contacts, but you need to limit the number of contacts, especially those that are outside of your immediate household. So we all, or most of us, live with one or more other people. Those are your household. But the fewer people that you have contact with outside of your household, the safer you are. So this is where our young adults in particular really seem to do a really good job of spreading the virus. They have large number of contacts outside their household. Practice hand hygiene. That is important and it's good. But again, it's not as much about things, it's about people. Wear a mask in those settings where you can't avoid the 3 C's. Stay home if you are not feeling well. And this is important even if you only have one mild symptom. And for every one of you, download the COVID Alert app onto your phones. And this would be very helpful for you to know if you have been in contact with somebody who's tested positive with the virus. So what can the county do? Limit the number of people in the workplace, especially in enclosed spaces such as meeting rooms. So by this I mean, if the work can be done virtually, it should be. If half of the work can be done virtually, it should be. You should be ensuring that the rooms that are in your office should have restrictions of how many people are in them. Restricting the number of people in a room, should you ever get a case in your workplace, and I think it's not just about should you, it's when you get a case in your workplace, will limit the spread to others. So ensure that those people who are working in county buildings are able to be well spaced. All staff workstations are physically distant from others. Limit the number of visitors into the workplace. And I have to say this one's very important because based on what I've already spoken about, watch the behaviors of your staff during breaks. We have so many outbreaks caused by staff not practicing physical distancing during their breaks, taking their mask off, having a smoke or a coffee or just a conversation with a colleague and taking their mask off. This is becoming one of our substantial concerns, is how do we change the behavior of our staff? Nobody thinks you're going to get COVID from a friend. We all think we're going to get it from something that we touch or some stranger. Unfortunately, that's not true. So I was asked really specifically to talk about masks and the evidence to support masks. So we have and have been for many months now putting all of the papers in well, not all of them because there's so many now, it would be hard for us to put them all on our website. But the ones that are on our website we try to put what we call the peer-reviewed literature as opposed to the gray literature on our website. When it comes to the COVID, there is lots of literature now, which is what we called published as preprint, meaning it hasn't gone through peer review. So we try to be very careful about that information. In the science world, what we would normally do is after you got written a paper, it would be peer reviewed, and there's a period of time, often quite a few months actually, between the time the paper is completed until the time that the paper is actually published in a reputable journal. Because there is so much need for information about this new virus, this has really largely gone by the wayside. Many papers are what they call pre-printed. So even reputable journals like JAMA, Journal of American Medical Association, or the New England Journal have what they call their preprint. So the articles are published and then are peer reviewed. So that's a little bit different than what you would normally see in the science world. There is increasing evidence that wearing face masks outweighs the potential risks. But I've never said that there was zero potential risks, but there are very few potential risks for wearing face masks and ways that can be mitigated. And every time we find a new paper, new evidence, it is put on our website. So this is just some of the things that I've just pulled off the website, which is there for you to look at. So if you look at systematic reviews and meta-analysis, so basically what they're doing is they are looking at all of the papers and all of the reviews that have been done on a variety of fronts and putting them all together, and they're sort of analyzing them as groups. It is very difficult and probably unethical to do studies on COVID-19. So taking healthcare workers, for example, and not masking them and sending them into COVID rooms to see if they get COVID more likely than masked healthcare workers. So we don't do those kind of studies. What we do though is look at it. You have to look at the literature differently in order to try and get the same conclusion. So there was a very interesting clinical study which looked at in a household. So this was interesting. So somebody in the household was proven to have COVID, and if they wore a mask in that setting, in particular, if they wore this mask before they had symptoms. So in China, there's a very strong mask wearing culture. What we found out was that 79% reduction in people in the household getting symptoms. So that's really a very interesting study, because it shows that you can live with people, and if you're masked, you don't have to transmit it within the household. And households are where we have absolutely seen the highest number of people giving it to each other, because they're very close contacts. You're living in the same person in the same room. So this was a really useful study looking at the ability to prevent transmission by wearing a mask within your household. We are able to compare countries which have high rates of mask wearing, and in particular, there's parts of the world where they have over 90% mask wearing. Part of Hong Kong, for example, that territory where they were able to compare the mortality to countries with low mask wearing, such as the United States has very low mask wearing, and be able to see that there's a substantial reduction in mortality. Some of the reasons for this are what we call biological plausibilities. So if you get a high dose of something, then you are more likely to be more sick than if you get a low dose of something. It doesn't apply to actually all diseases, but in general, the bigger the infectious dosage you get, the more ill you are, the more sick you become, because those number of virus or bacteria are able to multiply in your system. So the theory, one of the theories behind mask use is that you actually get a lower dose, which means that you are less ill than if you wouldn't be wearing the masks. So these are just some of the evidence that's on that page for you to look at. It is still and continues to be, in my professional opinion, that mask wearing has a place in this particular pandemic, because it is a respiratory droplet pandemic. It won't have a place on all pandemics, but certainly in a respiratory droplet pandemic, this is shown and is continuing to show to reduce the level of COVID-19 transmission of cases in our community. I pulled this off the Public Health Agency of Canada's most recent presentation to the public. This is a very worrying curve. This is a prediction, a long-range forecast of what could happen if we don't do anything. And if we continue along the existing path that we are, this gray line in terms of number of cases is likely what's going to occur. We have to do something to try and flatten the curve, which is here. I don't think any of us wants to see a reduction of either our economic engines, our businesses, or our schools being shut down, because they're very tied. But what I do believe is that you are going to see continued targeting of high-risk situations to try and flatten the curve. So the Premier shut down strip clubs, for example, as a high-risk scenario. They have reduced the hours at our bars in particular, and restaurants can stay open to try and, again, minimize this curve. They have reduced the number of indoor people and outdoor people in order to decrease the number of people, the transmission of this virus. Really, though, we can control this virus. We all have the ability to control this virus. As parents or people in businesses, we should be very interested in how do we control this virus. And it's really fairly simple. We all need to restrict our number of contacts. And when we have contact with people, we need to stand further apart than what we're normally used to. We need to wear a mask when we're having those conversations and social interactions. We need to limit the amount of time we spend in a room, like a meeting room, if that has to occur. So we need to be very mindful about how many people in a room and how long they stay in that room. And then if you should, in your workplace or in the county buildings, if you should have a case, then people need to go home quickly, we will find all the cases and contacts of our case, and we will ensure that they are tested or put into self-isolation to prevent the spread. We do have the ability to control this. It's if we give up or decide that we want to go back to the behaviors that we had earlier, this is not the time to do that. We are going to see a lot more cases. I said about a week and a half ago, I said you will see our cases double. At the time that I said that, our cases were 200. They went to 400. It will not take very much for our cases in Ontario to double again, or more than double. So that's quite concerning and should be concerning for all of us to try to prevent the spread of this disease. So that is where I'm stopping, and I'm very happy to take questions from councillors. Actually, you know what, I'll turn my screen down, so I'll stop sharing if I can figure out how to do that. Well, if I can figure out how to do this, I'll keep doing this while I'm trying to. Sure, you can talk to me while I try and figure out how to. Good. Thank you. Whoever did that. Whoever did that. Thank you. Sorry.
Thank you so much, Dr. Mercer. Thanks for putting that together and giving us a little bit of an overview there. I'm going to let councillors, and we're not going to keep you here all day, I promise. I'm going to give a couple opportunities for councillors to ask you their questions. Some of us have been receiving some questions from residents, so this is a really good opportunity for them to ask you some of the things that they've heard or been questioned about from their constituents. So we'll go around the room, and I'll start with Councillor Foster.
Thank you, Mayor, and thank you, Dr. Mercer, for a very interesting presentation. Mayor, I have two questions for Dr. Mercer. My first question, Doctor, is if we were to look at the cases at a high level, and if we were to divide them into quintiles, and we were to call them, for example, asymptomatic, mild, moderate, number 4 would be acute, and the worst cases being very, very critical. Doctor, I'm wondering if you can tell us, of those 5 quintiles, what would be the proportion or the percentage of each, or even more generally, what percentage would be moderate or better? In other words, no symptoms, mild or moderate. And the second category being acute or very, very critical. Can you help us understand that broadly?
Yeah.
The distribution?
The distribution depends actually on the age group that has it. So over the age of 50, we know that the mortality rate rises substantially, and most people become fairly ill in that age group. But if you happen to be 18, then most people, I would think probably 98 to 99% of them for sure, are going to have quite moderate to mild symptoms and may go out and pass it along to other people. So you can't really look at overall what happened. If you saw in the first wave, we had a higher incidence of people ending up in hospital because they were seniors. And so we will have the same thing. Again, the only reason you're not seeing our hospitals being overrun right now is because it's the young adults that are sharing it amongst themselves. So if it gets in the older age groups, and I'm looking around on my screen, so I would suggest that most of you councillors are more at risk than the people who are currently getting it. So we know that mortality rates in seniors, 5-10%, like for sure. Yeah, so if you're over 65 right now, I wouldn't want to roll the dice with this one. People get really sick.
Councillor Foster, a follow-up?
Thank you, Mayor. My second question, Dr. Mercer, broadly speaking, I get this question from some of my citizens, and I guess they're wondering, what's the point where a red flag goes up for the citizen, the individual? And what that means really is, what are the onset of symptoms that say to a person, look, I got a problem. I need to seek medical attention now. We talk about asymptomatic and mild, moderate. How do citizens know if it's a little sniffle or what's the trigger when they say, geez, I got to get to see my doctor or get tested?
Yeah, that's an excellent question. And the symptoms of COVID can range from very mild to very serious. So obviously somebody who's short of breath with a cough and should probably go to the emergency room if they're really, really struggling to breathe. But what we're seeing is that the average person who goes to our COVID assessment center, they may have been to a party or they may have been to a wedding, a church, some kind of social circle. So we're not talking about if somebody's at home, they're not seeing people, maybe they get their groceries, they're not seeing people and they have a little bit of a sniffle. The chances are it's not COVID, okay? So, but if that same person has been going out into the community, maybe going out for lunch with somebody that's not in their bubble, going out, as I said, to all of those social circles. And we do see that people are cheating. People are, well, I just had the grandkids over, you know, a couple times. I just had, you know, we're out in the backyard most of the evening, except when we came in and mosquitoes came out. So what we're seeing is people are cheating. And if there's any cheating that is going on, then you need to have a COVID test. Okay, so if you've been completely isolating and you know, and it's your normal seasonal allergies, and I think most of us know if we haven't seen anybody really in the last 2 weeks, well, then we're pretty safe. But if you haven't, if you've cheated, then you really need to get a COVID test.
Thanks, Councillor Foster. Councillor Van Leeuwen?
Thank you, through you, Mayor. First, yes, Dr. Mercer, I would definitely have to say thank you for coming. It is very much appreciated having you here, and I know you're very busy. And this topic probably could take up, I have enough questions to take up the next 6 hours. But I do have just a few little pieces that I am concerned with, and probably a lot of the residents that I speak to, and I would say quite a few are worried about. One of them is we really, really do want to care for our community, and especially, I would say, the vulnerable, those in the 70 years old and above, where we could say 80% of the cases are from, or actually, I should say deaths are from. And what's happening, and I noticed even on your chart, you speak about cases and all the different cases. There is in everything you have cases, and you have a difference between the morbidity or the death rate, which we see two different scales when you go to the websites as well for public health in Ontario and Canada, and they base those two. We tend to talk and live in the scale of cases, which tends to leave us in a zone of fear. And I'm concerned, especially because of fear is never good for a community. Fear is not good for your health, and it doesn't it's not a good mental spot to actually sit in. So how should we deal with, for example, in regards to when should we not begin at least to start speaking about the astronomical amount of people who are actually overcoming COVID-19, the rate of recovery and how good it is, the fact that we see an increased amount of testing and a stable line of morbidity rate. So should we not speak about the good news aspect of it as well, that people are actually getting through this? This is something that means if we have such a high amount of cases and the morbidity rate stays low, does that not mean that we're gaining immunity within the community? That would be my first question. Thanks.
Well, first of all, absolutely not. There is no evidence of, quote, immunity. We know that more than 95% based on serological studies are not immune to this. So there's so few people in our community that have actually had it and recovered that we have no community-wide immunity, and we probably are not going to get there. Even the U.S., with over 200,000 deaths, as well as millions of cases, has not enough immunity in their community to stop this. In fact, the modeling on what that would take is astronomical. So we're not going to get there. We're going to get a vaccine first, and that is important. In terms of have we beaten this, the answer is it's in a different age group now. And I just want to caution you that the age group that is currently spreading this around is not the age group with the worst outcomes. We actually have made some progress, that's absolutely for sure, in our ICU care and people recovering. What is becoming more apparent, though, and is very worrying, is that this virus is not a respiratory virus in the sense that the flu is. So with the flu, you would get it, you'd maybe be sick, badly sick, even if you're young, and probably a month after you've recovered from the flu, you're back to all of your own activities. In fact, maybe even sooner. So that's our typical respiratory virus. What we see with COVID-19 is there is a substantial number of people who months after they have COVID, even when they're young people, have not recovered. They're still having some fatigue, they're having vague symptoms, they're having some neurologic symptoms, some memory concerns. So what we do know is that this isn't a respiratory virus, this is a virus that affects multiple systems, and we don't know the long-term consequences of it yet. We actually don't know the impact on pregnant women. We know that they have higher rates of hospitalization than non-pregnant women, but what we don't know, Councillor, is what will happen to all the children whose parents, who's either, what does it do to sperm? What does it do to the unborn child when the mom's pregnant when we have this? So that is something that we won't know for 2 to 5 years, maybe longer. And that's something that's really concerning for us as physicians is we still have to be very careful to try not to spread this around because we don't know the long-term effects. And because if it goes from the younger adult population to the older adult population, when I say older, I mean over 50, so that's not old. So if we go into that population, yes, will people survive? Yes, I think quite a few people will survive, but what we can see is long hospital stays, many weeks to survive for that age group. And a fair number will survive, absolutely, but I don't think any of us want to be the person in hospital on a vent for 3 weeks before we survive. So it is easy, and especially for the young, to want everything to go back to normal. I want it to go back to normal. Desperately want it to go back to normal, but not now. It won't.
Councillor Van Leeuwen, follow on?
Yeah, thank you. And I appreciate that answer. And I think that everyone here definitely would agree that we want to protect that vulnerable sector for sure. And I asked that because, and I guess where I struggle the most, and maybe this is, and I think this is probably the questions I'm getting asked the most is, we're working off this projected modeling and looking at the long term with all the things we don't know, which I think that we should do. We need to kind of predict what we can, but we also have another area where and this is where my concern is, and I know Councillor Dunsmore probably he also his whole walk was around mental health, and there we have a lot of statistics as well. We know the long term effects of such things, and even coming up into, for example, our community emergency management, which is next on the schedule, there's something called the AIM. And it speaks towards protecting the health, safety, and welfare of residents, business, and visitors. Two of the other pieces don't matter, they're about critical infrastructure, but one of them is ensure future economic vitality, future resilience, and reduce vulnerabilities. I really do and am concerned for the people and the mental health of the people in our community. There's a very, very low feeling of, especially because we are now sitting at a time where the recommendations from public health are actually somewhat stepping or into the areas where you would actually place a mental health recommendation to say, speak to people, get help, assistance. So when we're in the area where it's, we have many people who are staying home, their businesses are collapsing, we see depression, concerns over feeding their families, but then we're going to see, we know that those are actually, I went on to the to study there, and it said those are some of the key aspects to the causes of suicide, especially depression. So when we know these are actually knowns, how do we deal with some of those things? Do we continue to encourage those people, but not build that sense of fear? And I think that's why I come with that question. Should we also speak towards the good aspects of what's happening out there, that we don't continue to build that fear? I do have one more question.
Yeah, and you are correct. I think I'm trying to the message is not about what you can't do as much as it has to be about how to do things safely, and you do have to limit. So let's be frank. I mean, the parties that we're seeing going on, the backyard barbecues, the birthday parties, I drive around, I have eyes, we all see it, you know, the bouncy castle, and there's 40 people in the backyard having a birthday party. Those are the things that are driving this pandemic. If each of us and all of our citizens, you know, acted in a way that was responsible, we would be able to have those social interactions. People can go out and see each other. Just, you know, just stay your distance, wear a mask. I'm not telling people they can't have interactions. I'm telling people to limit the number of interactions and to try and find ways to do things differently. And I think with Thanksgiving coming up, you know, if people go and have their family get-togethers that were, you know, that they've had in previous years, 2 weeks after Thanksgiving, we are going to see a dramatic increase in cases. And that is bad for business, and it's bad for our schools. I already have one school in outbreak with, you know, with classrooms and teachers self-isolating. We need our kids to stay in school so the moms can work. We need our business to stay open so people can have an income, and health and mental health are very closely linked. So we need that. It's really a struggle to try and get, if we give a little in our social circle and how we socialize, I didn't say not to socialize, and how we socialize, then we will gain a huge amount in being able to keep this virus at bay until we get a vaccine. We're going to have to learn to live with this for up to a year. So that's a very scary message. So we have to figure out a way, rather than, we can't give up. We still have to maintain certain behaviors, and we do have to figure out a way to improve as a society our mental health and well-being while we learn to live with this virus. And I think for staff, for example, we limit staff who come into our office, but we don't prevent it. If people live alone, then we target those people to come into the office, because that is their social connection. It's good for them. And so if people tell us, you know, I need to come into the office, I'm feeling isolated or alone. Well, yeah, come in. We will figure it out. And I think that there are ways that we can and should, as businesses and as business leaders, work with this virus. But it is scary, and it is a very challenging virus to deal with.
One last question, Councillor Van Leeuwen.
Thank you, Mayor. I know that you said 2 questions. So one, and I really appreciate your answer, because I do think that is, in no way would I condone that we should run around having big parties, and I can appreciate what you're saying in those ways, and I don't have a concern with people wearing masks. I think that if they desire to protect themselves, I worry sometimes a little bit about, especially because I am in the community a lot, and there's times where people need to remove that mask, and then we social, or I would say physical distance quite well. That allows to say, and you step back, and you could almost see their anxiety and their stress come off of them, to be able to say, okay, whew, all right. But and I understand the physical distancing aspect. One concern I do have, and this is with your Section 22 order update, you, I think from the very beginning, I kind of asked our mayor, and I said, listen, do we have a baseline? Like, listen, if we can all just kind of stay here, then, and we're going to try to get under this target of, you're looking at cases, and I looked at deaths. But where's our goal? Like, if we can see a goal, you tend to have more energy to get there, if you want to say. In regards to even, for example, Section 22 update, you also included places of worship. So, for example, but yet nowhere has there been cases where you'd say a strong case or evidence that says places of worship are the problems. So, for example,
may I correct you on that? We actually have a number of outbreaks in places of worship across the province right now, and some of the worst outbreaks in the world have been in places of worship.
Okay, so no, and I appreciate you updating that, because so one of the things in the place of worship is, and I hope and pray, actually, I see a lot of churches actually have implemented many good policies. In fact, they're following your guidelines. But there are aspects inside the place of worship where, in order to worship, members also will need certain certain aspects of worship. And I am concerned in a little bit in regards to, for example, the Charter of Rights and Freedoms and how that works with under Section 2. Do we sometimes, is it worth us stepping over top of the Charter of Rights and Freedoms to stem that? And that's somewhat a concerning aspect when I see that included into the mask bylaw of mandatory. If you can comment on that, that'd be helpful.
Yeah, certainly. I think that when it comes to Charter of Rights and Freedoms, that actually has been looked at. And in a pandemic, the Charter of Rights and Freedoms does change in terms of allowing things. People do not have the right or freedom to transmit a virus to other people. So in this particular case, mask wearing is quite defensible, and I don't have any concerns about the Charter of Rights and Freedoms. Now, if we were to continue it beyond the pandemic, I think that would be a very, very different scenario. And so I will be, and I look forward to someday removing my mask order, because I think that who wants to really live in a world where we continually have mass social interactions? As a politician, councillor, I just want to point out that we have had and continue to have around the world, but even in Canada, numbers of our politicians contract COVID because they are constantly meeting members of the public, and they weren't wearing masks, and they were so that they are at high risk for contracting COVID based on the number of encounters that you have. So just be careful for yourself and for your family to remind yourself that the more your social contacts, the greater your risk. When it comes to our churches are high risk settings. We have a number of outbreaks that are currently ongoing, in particular in my Old Order Mennonite community, where they are not wearing masks, they're refusing to do so. And currently we have a number of significant outbreaks right now that going from churches to schools to communities based on that. Churches are by nature enclosed spaces. People want to sing, people want to gather. They spend at least an hour in an enclosed space. And I think the limits right now are 30% of the capacity of the room, which does help. And as you know, somebody who goes to a religious venue weekly myself, when I would want to, I can certainly feel for for how this is hurting a lot of our venues, like all of our places that rely on people congregating, whether it's conferences, event centers, our religious venues, our gyms, our museums, our places, our theaters. These are all hurting because these are the exact types of venues that provide the worst outcomes. And so it's not really targeting religious venues enough. Truthfully, religious venues were not following the guidance of the Chief Medical Officer of Health, which strongly recommended masks. They took that as masks are optional. And so that was the reason to ensure that I tried to keep them safe.
Thanks, Councillor Bendo. And Councillor McSweeney?
Thank you. Thank you, Dr. Mercer, for an excellent presentation and your responses to the previous questions. They have helped put a lot of things in perspective for questions that we get as councillors. So I really appreciate that. I don't really have a question. I want to make a comment from a very selfish point of view. The one thing about the whole pandemic that has been the most negative for me is the fact that I've discovered I am not approaching middle age. I am considered elderly and vulnerable. And with that in mind, the restrictions to me are absolutely a huge requirement. I hope we continue with them and don't put economic decisions ahead of health decisions. So thank you for a great job.
Well, thank you very much, Councillor. And I do have to remind myself that economics and health are so closely intertwined, not just from a financial point of view, but from a mental health point of view too, that actually economics are one of the social determinants of health. So we try very hard to balance, and I hope And my goal would be that we maintain our businesses and our schools in such a way that we don't impact the health of our vulnerable population. So yeah, I want to keep our businesses open, because I think the majority can stay open and we can still maintain the health of our vulnerable population, because I think that is such a difficult balance right now to ensure that that we get through this all together.
Thank you.
Thanks, Councillor McSweeney. Councillor Kitchers?
Thank you, Mayor. I'd like to thank Dr. Mercer for coming. It's a great opportunity for us to ask questions from the community and from our associates and everything. So I really appreciate that. It's very welcomed. I just wanted to say that I use masks often in my work, and as a farmer, I use masks when spraying pesticides and insecticides and herbicides, and I use masks in my manufacturing when I'm batching chemicals and designated substances. And I've taught WHMIS to my employees under the Ministry of Labor guidelines for many years. And I understand workplace safety and practice and the role of practices and the use of masks for the right situation. The most important part of WHMIS from my training is that it's an information system and it allows for safety to proceed from that. So I have several questions from the community, but I have a question and it's about what specific criteria would you use to rescind mandatory mask orders for the general public with data that shows that there isn't increases in deaths and hospitalizations, but there are positive tests. So what would it look like to rescind the masking order but at the same time protect those that would be vulnerable, the most vulnerable, in terms of age, in terms of illnesses and vulnerabilities?
Yeah, thanks for the question. One of the things that I just want to point out is when you were wearing your masks for when you were spraying, you were protecting yourself from the spray. When you wear a mask now, you're protecting others from yourself. So what we need is, in order to protect the most vulnerable in our communities, everyone needs to wear a mask to protect others from themselves. Most people are infectious for 2 days from when they start to show symptoms. So if anybody on this council is infectious and tomorrow they get symptoms, you have to go back 2 days for those people that you've been in contact with that you may have unwittingly given the virus to because you didn't know. So part of why mask wearing works on a population level is we all protect others with our masks. If the mask protected myself, then it would be a civil liberties thing, right? I could wear a mask and I'm protected. You're not wearing one. Well, you can make your own decision, right? So that would be an individual rights. But when my mask is protecting you and your mask protects me, it becomes a little bit of a different argument. So the reason why we're not seeing the deaths right now and the mortality is not because our mortality rate has changed. It's the cases are in a different population. So I just want to, and I hope that we don't see what we saw in the spring. We have gotten better at getting people off ventilators. The ventilator rate to recovery was really low. It was like 10%. It was like really bad. I think right now we're about a third. So if you end up on a ventilator, about a third of the people get off. That's not very good. Like most people don't go into hospital with a 2/3 chance of a surgery making dying and 1/3 getting out. So the rate of recovery from COVID, if you get hospitalized, is still really bad. It's just better than what it was, but it's still really bad. The reason why our hospitals have very low numbers is because we haven't seen it move into the most vulnerable populations yet. And I think a lot of that's our seniors and our older people are taking very, very much protective measures. But it doesn't take much for the grandkids or for the kids to give it to their parents if they don't recognize that you have to just keep up the same behaviors in order to not spread it around. So we had, I can't remember how many cases we had this past weekend, double digits for sure. Locally, I think we had 11 or 12 cases this weekend. That's only the people that I know about. And with the backlog of cases, I'm finding out, cases from a week ago that are positive. So it's really challenging right now to know how many people in our community are actually have this. I can say you guys are more rural areas, that our rural areas have lower rates of COVID, not because they're resistant to it, not because, the farmer has any better chance than the businessman in town, but because they have fewer social contacts. So the more contacts you have, the higher the rates. So I hope, and actually the best case scenario is, Councillor, is that we would see that it doesn't go into the older population, that the younger adults hopefully maybe change their behaviors a bit. We still, and we're able to keep this out of our long-term care homes or retirement homes and out of anybody over the age of 50.
Follow on, Councillor Kitchus.
Thank you, Mayor. I didn't actually answer that because you didn't give the criteria that you would use to resist the mask. I'm sorry, that's sort of what I asked. It was
sorry about that.
Citizen that asked that. So I'm just saying that. But if I could just add about the information is, I looked at the Elsevier Public Health Emergency Collection that did a Swedish policy analysis of COVID, and they have age, locations for positive tests, for deaths, for ICUs, for hospitalizations, and they analyze it and they show it to the public. And I'm wondering why we're not doing that. So first, if you could answer the criteria for not having the masks, and also why we're not giving fulsome information.
Yeah, well, we have a lot of information on our website, sir, and we have a ton actually, and you'd have to dig for it on our dashboard, but it's there. You just have to push all the tabs and you can slice and dice. Public Health Ontario has it, and the Ministry of Health has it. So there is a lot of information out there on Ontario specific data. When you're looking at very small data sets like the County of Wellington, you probably aren't going to find it because the numbers are too small. So the data is usually run in larger areas. When it comes to when would the mask order be rescinded, it's really based on what we call the effective reproductive numbers. So are the cases declining? Is our reproductive number less than 1, because that means eventually it's going to burn out? Or is our number greater than 1? We have been at or greater than 1 now for some time. We did briefly hit 0.9 briefly for a few weeks in the summer, and we have been above 1 for the entire pandemic. That means that for every one person who has it, they are giving it to more than one person. So that is a negative sign. So that's disturbing. Also, the big thing that we are waiting for is the vaccination, so an effective vaccine. So once you either have broad community immunity, and we won't have that by the spread of the virus, there's no mathematical model that I've seen that predicts that could possibly occur. So we're really waiting for a vaccine. And in order for there to be a community the numbers that I've seen are actually remarkably low. Normally we look at vaccine rates of around 70 to 80% to burn a disease out. But even if we can get 40% of the population immunized for COVID, you will see our reproductive number will go below 1, and it will eventually disappear. So I would suggest that without making a promise, but that once we've immunized 40% of the population and or our number is substantially below 1, those are really good reasons to remove the mask order, that there's no longer a risk of people being able to transmit it socially in the community, which is the reason for the mask order, is to be able to prevent and to help with the physical distancing, because people don't always practice that.
Last
Does that
question.
answer your question?
Yeah, thank you, Mayor. I'm wondering about, you're saying that it's not possible to have natural broad spectrum immunity without a vaccination. So
Yes.
the vaccination, the immunity will only happen through pharmacological vaccination on a wide scale. You're saying 40% might be the threshold. I'm wondering why in other jurisdictions with climates like ours, like Sweden, Netherlands, Scotland, children have been back at school for 6 to 7 weeks unmasked with very few restrictions on activities and no social distancing. And so in those jurisdictions, they haven't seen a rise in like serious infections and stuff like that. And then at the same time, just recently, this weekend, the governor of Florida with leading epidemiologists and scientific fields, he stated, kids need to be the driver of immunity. This is a quote from that. The longer we drag out herd immunity through the young, the worse it will be for the elderly. So the question is, why have we not pursued a policy of herd immunity through the young who are largely mildly impacted? And at the same time, as in Sweden, protect the elderly, because the elderly are not allowed to social interest, and people over 50, a group of over 50 are not allowed to happen. So they have those policies. It's not like it's free for all, but they drive this herd immunity. So what do you have to say about that?
That's simple. So the UK pursued that, and their mortality rate and their rate of death was so high that they had to shut it down. And so Boris they got a lot of flack on that, and they actually had to change course because the course that they were pursuing was resulting in so many deaths that they had to change course. I think that in Sweden, you can see that they have one of the highest rates of mortality in the world, and that is a problem. And if you look at Florida as your success factor, I would suggest that Florida is done anything but well in this. Their hospitals are full. They're transferring patients. They have a very strict criteria for getting into an ICU in Florida. You have to be under a certain age. So if you're over 70, you're not getting a bed in an ICU in Florida. So yeah, if you're willing to pursue a strategy where you are willing to sacrifice a certain age group in the population because they are not allowed to get to ICU care. But I don't think that's how we would pursue that in Canada. And there is no evidence worldwide that children are driving this pandemic. Actually, it's quite the opposite. Children are probably not driving this pandemic, which is very atypical from other pandemics. Influenza is typically for children drive it. We have no evidence to support that in this pandemic. Our only evidence is that it's probably being driven by younger adults. And based on that, there's also no evidence to support that herd immunity is long lasting. We believe, as with other coronaviruses, it may last a year. It could be 6 months. It might be 2 years. We don't know that answer yet because we don't have people who've had coronavirus. But there's no evidence that there is long-term immunity from coronavirus, which, unlike measles or other diseases, is required to actually shut this down.
Okay. So I know that Dr. Mercer, you have to leave. Sorry, Councillor Dunsmore and Councillor McCrae. I want to respect Councillor Mercer's time. We probably should have limited it to one question per councillor to get around the whole horseshoe. And we really appreciate you taking over an hour to be with us. Dr. Mercer, we know that you have a lot of things to do. So I'm going to let you go off the call right now. Thanks very much. And thanks for your courageous leadership at a real difficult time.
And I'm so sorry, guys, that I have another call at 2 that I'm still late for. So, but thank you, and happy to respond to questions my team can if there are any other questions that I haven't answered. So,
thanks, Dr. Mercer.
thanks.
Okay, bye-bye.
Bye-bye.
So for Councillor Dunsmore and Councillor McCrae, sorry that we didn't get you. If you have some questions, Dr. Mercer, let me know that anything that she didn't get to today, feel free to send her an email or her team an email. Some of those questions were fairly involved, and I'm sure she would have had a good response to them, but it was going to take more than we had her on the agenda for. So we're going to move on to the next item on our agenda. Moving on to Linda, Community Emergency Management Coordinator, and our new emergency response plan. So I will turn it over to Linda. Also with us here is Hiranya, and she is going to be taking Linda's place because Linda is retiring. And I don't think you've changed your mind on that in the last couple of days, have you, Linda?
No, I haven't.
Okay, feel free to go ahead.
So you, first of all, thank you, Mayor Linton. Can you hear me okay? Okay, thank you very much. So no, I haven't changed my mind. I'm still on track and looking forward to retirement. So, but one of the last things that I really wanted to get done was the emergency response plan. It's been a project of mine, I think of all of ours, program committees included, for a couple of years now. We've been talking about updating our emergency response plan through our program committees, and I really wanted to see it through to the end. So we're getting there. One of the last council meetings to discuss the new plan and provide the report, just a brief overview of the report to council. So in the report, I'll just kind of highlight the last time we put together the last emergency response plan was put together in 2010. And that plan was primarily taking all 8 former emergency response plans, the 7-member municipalities in the county, and compiling them into one document. There were some changes to the plan, but for the most part, that was the overarching intent of the plan, was to bring them to one, so that we, as we do with our programs, try to keep things very coordinated throughout the county. And I think it's been a huge asset and a very significant approach to coordination and working through responses in the county. So this one took a look, as you can see in the report, a lot of responses that we've dealt with over the last 10 years. So every time we have one of those responses, or every time we do an exercise, we put together what is called an after action report. And part of that after action report talks about recommendations. What did we learn? What should we improve upon? What can we do better? Those kinds of questions. And we put those into the report. And while we've made amendments to the current plan over time, there are a lot of things that weren't included, or we've been working through with a number of other responses over the years. So we felt it was time to bring those into the plan. In terms of process, and I think many of you, staff and council members, who provided comments or feedback through the consultation process, we did 2 presentations, and then we provided, sorry, I'm in a room with a photocopier, so my apologies. We did those consultations, and then we provided an opportunity for feedback, which was very important, and did provide some changes to the current plan. So just to highlight, the section on the declaration is actually very little change to it, with exception of including a kind of a checklist for orders. And part of that was what Mayor Linton, Warden Linton, and County Council went through with respect to the order for the Section 22 order support for Dr. Mercer's order. We had a number of groups that we consulted with, and you can see the list there. One of those was the treasurers. The financial pieces were spread out through the current plan, And what we've done is we brought those financial pieces together and included them in one section that's called the financial consideration section. We've also included emergency social services, more detail on it in the plan. We had a separate plan with social services, but again, it was a separate plan, and sometimes when we have those separate plans, they get lost in the response process. So here it's a public-facing document. It's there, it's readily accessible for the public as well as for those responding. And then the last one that I wanted to highlight was, of course, debris management. And we've been talking about debris management and some kind of plan and how do we handle this more consistently for a number of years, going back to the time of the tornadoes in 2003. And now we have that section included in the plan. And then there's a couple of areas in there where I highlighted that we have added based on consultation. If there's any questions, I'd be happy to answer them.
Thanks very much, Linda, and thank you very much for your leadership throughout this pandemic. I'm going to ask councillors, and I'm going to start with Councillor McCrae and give them time to talk first. So, Councillor McCrae, any questions for Linda?
Thank you, Mayor Linton. Through you, I'd just like to say I don't have any questions as I attended the information sessions back in July and corresponded back with Ms. Dickson regarding some questions I had related to the documents at that time. I'd just like to congratulate her on her career and wish her all the best with her retirement.
Thanks, Councillor McCrae. Councillor Dunsmore?
I don't have any questions either, Linda, but I wanted to thank you for your service and the time you spent putting this all together. And I think Your Worship, it's quite shameful of you. She's decided to retire. You kicked her out of her office and put her in the photocopy room to give the presentation. That's just not fair.
Apologize for that. I had nothing to do with it. Councillor Kittress?
Thank you, Mayor. Linda, I was wondering on the page 19 of the emergency response plan, section 7, it says the signed emergency declaration by the head of council shall be sent to the following, and it makes a whole list, but there's no lower tiered councillors included in that list. And I was wondering why that was missing. And the second question I have, in regards to this whole emergency response plan, is what provisions in the emergency plan for democratic oversight by elected representatives?
Okay, first of all, the piece on the declaration, it's not directly sent to all the councillors because we don't have all of their contact information. So we send that to the heads of council, CAOs, for them to circulate to their staff and councils as needed. Just because it's difficult to keep with changing it, I'm going to call it a maintenance nightmare to try and keep contact information of a lot of breadth in place. And then can you repeat your question, the second question? Because I wasn't sure I understood what you were asking.
Sure. What provisions in the emergency plan for democratic oversight by elected representatives? I'm just wondering, like, where you, the emergency team or whatever comes back to the elected officials?
So that's a good question, and I've had that question raised a few times from staff and council members already. And actually it's under the head of council. So if you look at the section that's on the incident management system, and I actually did a training session with the town of Erin Council a few weeks ago about this, and they were surprised at how much they found our responses actually follow the incident management system. And if you go to the organization chart, you'll see the EOC director, and the EOC directors tend to be, for a lack of a better word, the CAOs. So, and I'm sorry, I think it's section 8. So typically the EOCs are, the EOC directors are the CAOs, and you'll see the head of council sort of there as an advisory function. I think even if you ask Mayor Linton from both township and center county perspective, they don't tend to make a lot of, with respect to decision making. It's been more of a service continuity and an operations meeting. But what the head of councils do out of that is bring that information out and share it as they need to with members of their council. And we've been trying to do that both through our county EOC minutes and I think your local minutes, as well as through the mayor and CAO minutes.
Thanks, Linda. Councillor McSweeney?
Thanks, Kelly. I just had a kind of on the same topic. Basically, in section 8 that you were just referencing, Linda, you talk about the notification procedures, and for most of the county, there is an individual named, either the CAO or the fire chief. In Center Wellington, it's the infrastructure call center, and could you define what that is exactly? I don't know what the infrastructure call center is.
It's my understanding, and I'm going to let maybe Colin jump in there later to answer, but it's through your public works department. We do notification exercises on an annual basis with municipalities and staff, and partly it's exactly that, is to sort through what's the best way to notify the members of the control group. And over time in doing it in Center Wellington, we made a number of changes. But, that is the current structure that we're using and seems to work, is through that infrastructure system. Because as I understand it, it's an on-call and it's a 24/7 type of system.
Thank you. Other than that, congratulations and all the best for the rest of your next phase.
Thanks, Councillor McSweeney. Councillor Van Leeuwen?
Thank you. I wanted to start with saying thanks, Linda, for your work, especially on this committee. You've led many, including myself, through these EOC training exercises and all the different parts of it. So thank you for your work there and your professionalism. Yeah, it is a good document, and I've watched all the different training pieces as well. I appreciate that you do have the section 4 in there, which is our aim, and I'm glad for the work that's done by the entire committee actually to pull this together. And I'm also thankful to the councillors. You can tell everybody read it. I think that's important. So thank you for your work and have a good retirement.
Thank you, and I agree. I really do. It's a team effort, and I appreciate all the feedback that we've received so far on it. So thank you for that.
Councillor Foster?
Thank you, Mayor. I do have a question for Linda. Linda, section 10.1.3, I believe, speaks of 3% of our own purposes taxation, and I just want to confirm that's kind of like a deductible, if you will, or a threshold beyond which we can apply for funding from those two government programs. Am I correct that that's for example, in our case, let's say our taxation is 15 million, roughly that's what it is. So 3% would be 450,000. If we have a disaster that costs more, you have to meet that test, first of all, to apply for the funding. And then your report goes on to specify how it's broken down. Could you just confirm and talk us through the finances of that?
So thank you very much, Councillor Foster, for that question. And I think that Dan would probably be better to speak to it in terms of the all-purpose, the 10.3%. But what I will say with respect to this is it is a system that has evolved after 50 years of being a somewhat erroneous and difficult system to work through in the funding. So they came up with this system, and I think most treasurers understand. One of the questions that was always raised is, what kind of fund can we expect, or what kind of monies do we have to spend in order to think that we're going to see some kind of a return from a funding perspective if we go through all this application process? And we never had that under the old system, but now with this in place, at least from a financial perspective, your treasurers and your staff can go through and they can kind of do exactly what you said, that calculation, and kind of figure out if they're meeting that threshold and whether it's going to be worthwhile to actually submit the applications to the province. What I will say is Centre Wellington actually was one of the first ones that went through the new system back in 2016 when you had the ice storm around the Easter weekend. It was just a bit before that when this new system came into effect, and the township, as I understand it, went through the new system and actually received some monies back through the ice storm for funding. So staff are very familiar on how it works and how to use it, and we have had some success with this process, funding process in the past for Centre Wellington.
Thanks, Linda. You have a follow-on question, Councillor Foster?
Thank you, Mayor. Thank you, Mayor. Perhaps, Mayor, I'll redirect my question to Dan, our treasurer. Dan, let's suppose we had a disaster of some sort, and our costs were $1 million, and let's use my example of $15 million in general taxation for our own purposes. Can you just talk me through the finances of that, the thresholds and so on, in an imaginary claim for $1 million on $15 million of tax?
Yeah, thank you, Councillor Foster. Through Mayor Linton, looking at Section 10.1.4 of the plan, 1% of our taxation levy is around $145,000. So 145 representing 3% would be $435,000. So eligible costs up to $435,000 would be a provincial contribution of 75%, and then we would contribute 25%. But once you exceed the $435,000, so from the 435 up to the $1 million scenario, you would be eligible for up to 95% provincial funding, and 5% would come from the township.
Thanks, Dan. I'm going to read the recommendation that the Council of the Township of Centre Wellington receives emergency response plan report dated September 28, 2020 regarding the new employee response plan for the Township of Centre Wellington, County of Wellington, and the member municipalities, and further that the Council of the Township of Centre Wellington authorize the passing of bylaw adopting the 2020 emergency response plan for the Township of Centre Wellington, County of Wellington, and member municipalities. Can I have a move for that recommendation? Councillor Dunsmore, second by Councillor McElwain. Any last questions, comments about this report? Councillor Kitchus?
Thank you, Mayor. I have a question about the recovery plan. The recovery plan, does it happen after the emergency is called off, or is it part of the whole emergency package? And is there any time limit provisions for that recovery plan, or like, so how does that work?
So thank you for that. So the recovery, it's, if you're, whenever I've done training and then when we do the basic emergency management course, at the beginning of the plan, we talk about things from prevention right through to recovery. It's very much a cyclical process in terms of emergency management. But that time frame between response and recovery is not necessarily definite. Oftentimes, there's still response going on in a recovery phase. And I'll take Centre Wellington as an example again. So back in 2003, we were in emergency declaration phase with Centre Wellington for the tornadoes for well over 2 weeks. I would say of those 2 weeks, about 2 to 3 days would probably have been response phase, and the following we were well into recovery. So you don't want to, there's sometimes there's that fine line between you're still responding, but you need to start thinking about recovery and what's that look like. And I will say throughout the COVID process, we've probably been doing that from the get-go. What's this going to look like? When are we going to be able to open our doors? And what's that going to look like when we open our doors? So there's that whole piece that plays along in terms of recovery. And recovery can last a really, really long time. And I'm going to give an example from where I live in Woolwich Township, because I'm also a member of a group that's called the Technical Advisory Group for the water contamination issue that happened back in the early 90s with Oil. And we are I joined that team because what I really saw it was as a recovery team. We're still dealing with the contamination 30 years later. I mean, we don't look like we're going to get out of that situation anytime soon. So recovery can take a very, very long time. And I think the purpose of that, well, it's not, I would say, a robust recovery plan by any stretch of the imagination. It highlights some of the things that we should be thinking about in recovery. And really and truly, when you get to a certain point, you need to maybe start taking that recovery piece out of the hands of the control group and council, and maybe looking at more committee structure, just because of the long-term nature of some recoveries and how they can go on for a really long time, and then have those committees report back to council. Hope that answers that question.
Thank you.
Thanks very much, Linda. All in favor? And that carries. Thank you very much, Linda. And thank you for your 34 years of service to the county. It's been an absolute pleasure for me to work with you over the last 6 years, but especially over the last several months during this COVID. I know your leadership was invaluable at the county level and at the township level. I know the county's losing a very dedicated and dependable member of their management team. So on behalf of Central Wellington Township Council, thanks for all that you've done for us, and we wish you all the best in your new retirement adventures.
Thank you very much, Mayor Linton. I appreciate it. And Central Wellington is not one of the municipalities I have any concerns about. So thank you very much. Do a great job.
Thanks, Linda, and welcome aboard, Hiranya. Looking forward to being able to work with you a little bit more. Okay, moving on to 3.3, a very brief county council report for me today. A couple things that happened last Thursday. There's a motion from County Councillor Jeff Duncan that unanimously passed, and it directs county staff to report back to council by the end of January 2021 through our roads committee on whether the county should establish county-wide community safety zones. So this is aggressive driving and intersections that are unsafe. We all have those in all of our municipalities, and I know a lot of councillors, and I know myself as well, we deal with aggressive driving and traffic concerns every single week, almost every single day. So this was unanimously passed by council. It was a very well-written motion, and it provides the opportunity for staff to research the topic and provide options and recommendations back to council. So there's a lot of support from that, and Wellington County is moving ahead on transportation master plan, and this will be integrated into that more wholesome plan. So that's something that is of interest to all of us and all the wards that we are looking into. Just a word going into our 2021 budget at the county. There's been substantial agreement among a lot of the county councillors that I spoke to that we have to keep the tax rate as low as we can, given the challenges that people are having right now with COVID and their responses to COVID. We have a lot of families and businesses who are struggling right now, so we do recognize that. Also, we have 3 members of the county's management team are retiring, and we had little presentations for them at our last county council meeting. They were given 1 red rose for every year of service. So Janice Hindley, director of Wellington County Museum, she looks after the Wellington Place campus. She had 21 years at the county, so she received 21 roses. Mark Bolzon was the purchasing manager for the county, and he's worked at the county for 15 years. And then, of course, Linda Dickson and her 34 years of county service. So appreciate all the work this team has done. And so the county has had to do a lot of succession planning over the last few months, and this past week was no exception to that. So congratulations to all three of those long-standing county councilors. Can you guys still hear me? My screen is completely frozen right now. I can't see anything. So
We can hear you.
I can hear you.
That's good. I can't see you guys anymore. You're all frozen in kind of weird poses. So I'm going to have to reboot.
I can hear you.
I'm frozen on my screen, so I can't see any hands or anything. So I'm going to move on, and I'm going to ask for confirmation of our agenda. I have a recommendation that the Council of the Township of Center Wellington confirm the agenda for its meeting held September 28th, 2020. Can I have a mover for that recommendation? Say your name because I can't see hands right now.
Dunsmore will move it.
Thanks, Councilor Dunsmore. Seconded by?
Dan Lewin.
Thanks, Councilor Van Leeuwen. Any opposed? And that is carried. Confirmation of the minutes. We have two sets of minutes there. One from July the 27th council meeting and one for our August 24th council meeting. I have a recommendation that the minutes of the council meetings held July 27th, 2020 and August 24th, 2020 be adopted as circulated. Can I have a mover for that, please?
I'll make that motion.
Thanks, Councilor Dunsmore. Seconded by?
I'll second it. McCray?
Thanks, Councilor McCray. Any opposed? And that is carried. We have, moving on to 6, a report from Committee of the Whole from September the 21st, 2020. I have a recommendation there that the Council of the Township of Center Wellington approve the report from Committee of the Whole dated September 21st, 2020 as circulated. I have a mover for that recommendation.
Kelly, I'd like a question first.
Sure, go ahead, Councilor McWayne.
Thank you. It has to do with number 5. Yes, number 5. And it's just I'd like a clarification because for the last 2 weeks, the advertiser has mentioned that had the decision been put off till next year on the digester roof, that it would have cost $500,000 was because of that. And in fact, $328,000 of that was already in the budget because it was over budget. And I just think that should be clarified for the public. There was no chance ever of a $500,000 overshot because
at the request of Mayor Litton, we're going to take a 10-minute recess while he reboots and just hold tight until such time as we bring you back.
Yeah, completely froze all of a sudden.
Oh, you're not muted either, so I can't mute you either.
It looks like I'm still on.
was sorry to hear the sad news about Paul Walker. That's a real tragedy.
Yeah, that was, I've known Paul for probably 25 years.
Wow.
Yeah.
He was always a hard worker. He had his hands in so many things, you know. I just loved his spirit.
Yeah, he was always into everything, you know, and he always made really good contributions to everything. So
Yeah.
yeah, sad day. And just a congrats to you too.
Oh, thank you.
Yeah.
Thank you. It was,
Great job.
yeah, it was kind of hectic in the end walking into a hot dome and trying to keep people socially distanced with masks on, and everybody wants to hug and everybody wants to high five. I think I bathed in Purell just to keep myself clean. So.
Well, we were coming back from Quebec City, and Quebec City apparently is going under level 4.
Oh. I can see why it happened in Ottawa. You know, we masked up and we were walking with masks, but there were a lot of locals that weren't. They weren't masked up, and even the manager, like we went for dinner the night before I closed, and I had $5K left, so let's go out for dinner. So we got about 6 tables on a patio down the street from the hotel. When we got there, the manager said, "Hey, it's getting a little cool. I've set you up inside in one big table." I said, "Nope.
Oh, jeez.
I don't give a damn what you want. We're staying here." That's all there is to it. Yeah, it was amazing how cavalier he was about it.
Friday morning, I walked outside of the Shadow Frontenac, and there's a great big park out there.
Yep.
And there was one person in it at 10:30 in the morning.
Wow.
One. Buses are all driving around with nobody in them.
Yep.
Pretty scary stuff.
Yep.
And I better mute up here.
Yep.
Okay, I think we'll get started again if everybody's back. Sorry about that. All of a sudden, my one computer froze all up and had no internet access, so I had to flip computers around. So just took me a bit of time. So can everybody hear me? Everything's good? Okay, good. And got Councillor Van Leeuwen back. Councillor Foster, are you back? Okay, so we'll go ahead. Sorry, Councillor McSweeney, you were talking about the report that was publicly went out publicly about the $500,000, and you want a little bit of an explanation on that. Dan, did you get Councillor McSweeney's question before I froze up? You did? Okay. I'll turn it over to Dan to answer your question.
Thanks, Mayor Linton. So we did have a $500,000 top up in the draft 2021 capital budget. That was needed over and above the $2 million that was approved by council in the 2019 budget. But in comparison to the report that went to council in August, COR 2020-43, it called for $328,000 to be required over and above the $2 million to award the RFP. It's really the difference between the $328,000 and the $500,000 was the anticipated cost of postponing the RFP to 2021.
Thank you, Dan. That's I think it was important that be clarified for the readers of the advertiser.
Yeah, thanks for bringing that up, Councillor McSweeney. Now, did I get a mover a second? Okay, so I did read the recommendation, moved by Councillor Dunsmore, seconded by Councillor McCray. All in favor? Opposed? And that carries. No delegations today. Next item is consideration of reports, and we have a report of the extension of a contract to McSweeney Associates to look at a business park strategy. And I will turn it over to Brett Salmon to introduce his report on that one. Go ahead, Brett.
Thank you, Mayor Linton. So with this report, we're requesting council consent to authorize the contract extension to McSweeney and Associates. McSweeney and Associates are the consultants that prepared the township's economic development strategic action plan a couple of years ago, and they were great to work with. In the 2020 capital budget, we have proposed $50,000 for the land development strategy. And so we'd like to use McSweeney and Associates to carry out that strategy. They've given us a quotation that identifies the scope of work, which includes economic base analysis, labor force analysis, identifying key sectors and target industries, market and location analysis, some assistance on the design, the infrastructure, planning and servicing of the land, financial analysis, property administration and marketing advice, and to help us with policies to deal with the township's ongoing involvement in industrial land in terms of thinking of things like a pricing strategy, so that we can, as market values change out there, we can adjust the price accordingly without having to go back every time we get an offer and deal with it individually. So we've taken that this proposal to the Economic Development Task Force, at their last meeting on September 15th. And they passed a recommendation that we recommend the council engage McSweeney and Associates for the development of an employment land strategy recommended as a necessary resource under the Economic Development Strategic Action Plan. So that was passed at the task force just last week, and Don Valerie is on the line to speak to the committee discussion about that. One thing I wanted to say, we have attached the proposal, and that is what council's seeing is what the task force saw. But the task force would like the opportunity to work a little bit more closely with McSweeney when they're retained, in order to be able to adjust the terms of reference as necessary and provide an updated quote. But we do want to show that we'd like to work with McSweeney and Associates going forward on this strategy. Thank you.
Thanks, Brett. And I'm going to turn it over to our invited guest, Don Valerie, the chair of the Economic Development Task Force, to say a few words about the importance of this strategy. Welcome, Don.
Thank you, Mayor Linton. Hello to everybody, all the councilors and everybody else. Yeah, we went through this last week, and the first page of the McSweeney report, it was done on April 7th, and our world has kind of changed since then, to say the least. And we want to sit down with them and go through their proposal here to try to trim it down and just get them to do exactly what we need. There's, township's great. We got the land. We need this piece to help us get organized to sell the land and develop it. And then hopefully next spring we can get some signs up and hopefully start marketing it. We have virtually no land now. I think everybody knows that. And sooner we can get this on the market, it's there. Let's see what we can do to get it going. That's about it.
Great. Thanks very much, Don. Appreciate you coming here today. I'm going to turn it to the councillors now, but I'm going to have Councillor Dunsmore and Councillor Van Leeuwen speak first as the council representatives on the task force, and then we'll talk, provide opportunities for the rest of the councillors to weigh in on this. So I'm going to turn it first to Councillor Van Leeuwen to speak to this first. Councillor Van Leeuwen?
Yeah, thank you, through your mayor. Yeah, this is something, obviously we knew these steps were coming. We had put these the budget in place knowing we really needed a plan. I definitely, even reading through this, we as economic development recognize that there is some overlap of things that we may have already completed. But we wanted to ensure that we could move forward within the budget allocation. And that's why economic development wanted to maybe just kind of readjust and trim and move and be part of a big part of working with McSweeney. That also, we've done that in the past, I believe, as well with them on previous projects as well. So it's something that I think is key to getting this land out there. And I think that I look forward to actually having this land sold, serviced, and getting jobs in the area. So thanks.
Thanks, Councillor Van Leeuwen. Councillor Dunsmore?
Well, I was busy walking between Lindsay and Peterborough at the last economic development meeting, so I missed a lot of the discussion on that. McSweeney and Associates is somebody we've used in the past, and I think consistency along the line should be held here. Revamping is a good idea under the COVID situation and changing the parameters of the study. So my guess is it's going to be less, so it might come in under that 50K. I think it's imperative that we use somebody like them that are familiar with the township, and we can get this thing service ready and get it to the market and get the best bang for our buck.
Thanks, Councillor. I just wanted to say a couple words that I'm going to turn it over to councillors. Firstly, McSweeney was really good to work with when we did the economic development strategy. They're very adaptable. They're flexible to meet the needs of the township. And we also use them to do the county's strategic plan 2 years ago as well. And again, they did a really good job. They're very good with facilitation and making sure that it's a kind of a made-in in our community plan at the end of the day. One of the things that we did mention at our last economic development task force meeting is we want to make sure that when McSweeney has completed this work, we can move to action right away. We want to make sure that the recommendations are very practical, so that we can finish this piece of work and then go and move towards marketing and selling and getting businesses in our new business park. We didn't want a body of work to be done in between us actually moving to action. So that was something that was really important to the task force, and something that we identified as our first need with working with McSweeney to make sure that we lay out right from the beginning what the deliverables are going to be, and make sure that they're as action oriented as possible. So I think that was some of the nature of the conversation that we had at the Economic Development Task Force meeting. And the task force had a really good experience working with the consultant that's being recommended right now, and they'd welcome the opportunity to meet with them again, work with them again. So turning it over to the rest of the council, Councillor Foster.
Thank you, Mayor. I'm very interested in economic development matters, and we want to have a strong business sector. I'm very, very supportive of that. And having land available for expanding businesses is a very, very good thing. My only concern is we have economic development staff of our own on salary, and I'm not clear why we could not have done this work ourselves. My question to perhaps Don, but probably to Brett Salmon, what is it that they're going to do that we could not have done our in-house? Probably to Brett, since it's a staff matter. Can you help me understand why we had to contract out and hire yet again another consultant to do this work when we have our own highly qualified staff in-house to do it?
Yeah, go ahead, Brett. That is a Brett question.
Yeah, well, certainly we do have qualified staff. But I think what you get when you hire a consulting firm, they bring a team of people to the table. Then they have a group of people that have a variety of expertise that they can bring to the table. Some planning, some in land development expertise. You know, we need to look at what's the industry target sectors we want to go after here. We need to have to look at optimizing the yield of the land so we get the best, you know, in the development industry, they would call it what's the buildable frontage. We want to get the best buildable frontage. And that's not the specific expertise that we have on staff. The other thing to remember too is we only have one EDO. And if you look at all the projects that are in the strategic action plan, one person would be challenged with trying to complete all those things. So we've got CIP review that we have pending. There's projects in the strat plan about reviewing our agricultural zoning and the permitted uses. And so we do need an expert here to bring in the variety of people that we need to keep this moving forward. As we are out of land, there's, I think, one lot left on Gregson Court, and there's already interest in this land, knowing that from the people that know that we bought it earlier this year. So,
thanks, Brett. Just for people who are listening, understanding, an EDO is an economic development officer, so as one staff person that we have. Dawn, from your perspective as the chair of the task force did recommend going out to an expert for this. Do you want to make any comments to Councillor Foster's question?
Yeah, when we were talking a few minutes ago, I mentioned that we want to have a meeting with McSweeney, and part of the reason is we have more information now than was available even back in April. And so we have some of that information, but we just want them to fill in the blanks. And the really good thing about McSweeney is they've been working with the township and the county for years. They've got all the backup information. So it's not like somebody's starting at square one. And they've got the various sections of expertise. So I think it's a really good match. And I think the thing is when we get the go ahead is to get a meeting with them as quickly as possible to get the whole project slimmed down so that we just get what we need to proceed.
Councillor McLean?
Thank you. Yeah, as somebody who has attended economic development for the last 15 years now, number one, I think McSweeney and Associates is one of the best in Canada, if not the best, most versatile. And number two, I agree that having an organization with their wide range of expertise is going to help the overall project immensely. So it would be very difficult for Pat to fill in all of the information that McSweeney can bring to the table in this case. I do have a couple of questions though about reading through the document. Although it's called a business park, there's an awful lot more reference to industrial land development versus business park development, which you've heard me before, I don't think that's where we should be focusing as much, number one. But number two is, as McSweeney goes through the process, if it looks like there's a great market for business park development versus industrial land development, would the township consider developing a little differently? Because I don't think there's any way in the world you're going to find office buildings being built on Dickson Drive right beside industrial development, maybe back in the other corner someplace, but not right beside Dickson Drive. So I'm wondering if the township would consider changing the priority of what gets developed when.
Yeah, I got to turn it over to Brett, because I know that we've had a lot of conversations about the business park and what it should look like, and it's pretty clear from the conversations that we've had at the task force is that we want to be as flexible as possible to build a business park, not just an industrial park. We want to build a business park that is flexible in how we size the lots, where they're situated. So I know that that's something that we want to work with McSweeney on to make sure that we can be flexible to where the demand is. But I know that, Brett, you've had some conversations with the members, and I know I have too, about exactly what Councillor McSweeney is talking about, our flexibility.
Right. Thank you, Mayor Linden. We do have, we've acquired the land at Dickson Drive for the reason of it being the quickest to bring on stream. And you can see reflected in the proposal here that part of what McSweeney intends to do is review our official plan and zoning bylaw to see if there are changes that need to be made to the uses that we would put in this business park in order to make it, different than your typical sort of industrial park, which is what's there now. We do have the advantage of we're going all the way out to first line. There's already some institutional use out there, so office type uses may be more compatible in some places than others. But we've also talked at the committee about not isolating this review only to the land that we have. That's obviously the first priority to move it along, but we also want to look at the other lands available in the township in general, so that what we do here is complementary to other land that we have.
Yeah, follow on, Councillor McSweeney.
Thank you. Yeah, I just, Brett, your last comment there, number one was, I'm really happy to hear that, because I didn't see that anywhere in the document that was presented to us. So looking at other land was something that I was hoping that was going to happen. Just as a follow-on to that, and maybe this is a question for Kelly, actually, the best land in Center Wellington right now, as far as location, everything else for development of what I'll refer to as the high-tech industry or institutional or whatever, is county-owned land. And are they doing anything with that piece of land? I mean, they cleared it about 3 years ago, and it's still sitting there with not doing anything since then. So just curious if that is part of the equation, because that would bring jobs to Center Wellington as well.
Are you referring to the Wellington Place campus, Councilor McSweeney? Okay. Yeah, no, there's no right now. The thought for that is institutional. The continuum of care project, which has only been approved to establish the business case for to this point. That is the land right beside long-term care is where that is scheduled to be. But as far as high tech or business corporations, it isn't in the county's plan right now to have that there, with the exception of any post-secondary education or educational facilities that might have like a thought leadership type piece to it. I think that would fit the current plan, but there is a lot of land there, and I know that the plans for that property are still being developed, but it isn't seen at this point as like a business park or a technology park.
I was hoping they were going to be looking at the healthcare industry for that piece of land, because there is so much development going on in home healthcare and remote health that it seems to be a natural fit. So that was kind of where I was hoping that would lead.
Yeah, I wouldn't rule that out. As you think about it, like offshoots of on the medical side of things, I think that would kind of fit with what's being developed in Wellington Place campus for sure. Councillor Kittredge?
Thank you, Mayor. I have a few questions here. My first question is, well, first of all, I'd like to say my condolences to the family of Paul Walker. Worked with him for 4 years on economic development, and he was, he was always engaged, and he made great contributions to that committee. I'd also like to thank Don Valerie for coming today. He has made some valuable comments, but I have some questions, and one of them is, it was mentioned that we have an economic development officer, and I'm wondering why she's not presenting this. And like, she rarely presents on economic development. And so I'm wondering, why is that? And the other thing is, from what Dawn said, there's a lot of tweaking that's going to be happening with this document. And so I'm wondering why we didn't go to tender when it could have been cheaper, as he suggested.
So I think probably the first question is for Brett, as the managing director in charge of economic development. It does make sense for him to be doing the reports, but I'll let you speak to that a little bit, Brett, and then we turn it over to Dan on the procurement side of things.
Well, it's the reason you gave, that I'm the director of the department that includes planning and development, which includes economic development. Most of the reports that are done are done by the directors. But secondly, the tie in here, and the reason why I've done the report is because of the procurement, and I needed to turn to the advice of Dan for a way to present a report like this to comply with our procurement bylaw, and what the report needed to say to be able to award to McSweeney.
Dan, did you want to just touch on our when it comes to sole sourcing, what our requirements are?
Yeah, thanks, Mayor Linton. So our purchasing bylaw does allow for negotiated procurement when we have recently completed work and there's additional work or an extension of work that is potentially required that pertains to the work that was just completed. So we're well within the requirements of our purchasing bylaw to go through negotiated procurement and hire McSweeney and Associates because they had just recently completed the Economic Development Action Plan.
Thanks, Dan. Follow-on question, Councillor Kittredge?
I have no more questions.
Okay, Councillor Dunsmore, you went already. Councillor McCrae?
Thank you, Mayor Lynn. I have two questions. I guess, first of all, I share Councillor McElwain's interest in the focus on having a business park as opposed to an industrial park. My concern about focusing on industrial is, will we have suitable housing to match the living standards of people working in the industrial sector? And is that going to be part of McSweeney's investigation? So maybe if I could have a response to that first.
Brett?
Just trying to understand the question. Are you thinking of the housing available in the community versus who might live or work in the businesses?
Yes, it is related to having available housing in the community to support the people who'd be working in industry.
Right. Well, I mean, we haven't specifically asked McSweeney to look at our housing sector. Affordable housing is something that the county's got a strategy that we're working on, and the provincial government has things that we need to do, changing our zoning bylaw and the official plan at the county level that are being worked on right now that address housing affordability in general. But overall, I think the province direction is it's a supply and demand situation, and so there's demand and we need more supply at the bottom line. But we recognize in doing this strategy that we've had fairly significant residential growth in the community over the last 5 to 10 years, and we need to balance that off with more employment growth. And so purpose of this strategy is to make the business park the most beneficial in terms of the most efficient layout, the most cost-effective development that we can plow back into keeping the township employment lands going and provide the right mix of jobs in the community.
I just wanted to make a comment, and thanks for that, Brett. I think that helps out on the housing side, but I want to make a comment that I think is shared by the two other councillors on the committee and Don, Valerie, and the rest, is we really do not see this as an industrial park. We really see it as a business park that is very flexible. We've had a lot of conversations about this. So we aren't, as a group, we are not picturing just a replica of what we see in the Fergus Industrial Park right now. That is not what we're looking at. We are looking at different kinds of jobs. We're looking at a flexible spectrum of different businesses coming. So anywhere where McSweeney has put in industrial park, we have to do a search and replace, because that is not the focus for this work to be done. We do not want to go in assuming that it's a certain kind of business coming here, and that's why this work is important. We want to make sure that we're attracting the businesses that are going to create a significant amount of jobs and investment into this community. So I just want us to be cautious about that. We're not seeing it as an industrial park. This is a business park. So hopefully that helps a little bit. Councilor McCrae, you had another question as well, right?
Thank you, Mayor Lynn. Yes, my other question is, I'm sort of curious now, when Don Valerie mentioned talking about tweaking the current proposal. I mean, I find the proposal excellent in terms of the scope of strategy. So I'm curious, what sort of things are you proposing to remove?
Well, I haven't gone through on that bent looking at the specific ones, but some, like the job market right now is substantially different now than it was in April because of COVID. Like, there's different people available. We don't want to overdo the engineering. Don't want to overcomplicate it so that we can get it built as soon as possible. Some of the ideas we've thrown around were to try to do it and maybe put a third of the road in, so that the cost of doing that, then we can get projects going on each side of it. And then we do the next third with some of the funds that are left over from that, so that we're not coming back to council all the time, so we can try to self-fund this thing. That's the sort of stuff that we're looking to go over with McSweeney. We think some of the stuff that's in, and I can't give you specifics because I don't have them right at the moment. We think some of the stuff that's in the proposal is maybe not necessary.
I think I want to add to that a little bit, Don. The nature of the discussion that we had is that we wanted to make sure, and I talked a little bit about this already, but we wanted to make sure that when this project is done, it's not just a consultant's report that sits on a shelf, and then we have to do more practical work to start putting the shovel in the ground. So when we looked at this proposal, we know the task force knows that they want to work with McSweeney because we've done it and they were excellent. And we know that they can be flexible to suit our needs. So when we looked at the different things that McSweeney talked about, the market analysis, the location analysis, all that kind of work that has to be done, we wanted to make sure that we could tweak the proposal up front so that when we're done that analysis, we can move to action right away. So that's where the task force said we want to have a little bit of leeway to stay well within the budget, but make sure that we got as action oriented as possible when it came to our final report. Because sometimes when consultants put these reports together, the level of detail that they're getting into isn't always clear. We just want to make sure that it results in something that we can move on. So that was the flavor behind the conversation that we had when we talked about maybe making some slight changes to their proposal. But I agree with you. Their proposal is good. It does demonstrate that they understand economic development, and it does demonstrate that they understand our Center Wellington's place in that market, which I think is some of the reasons why we wanted to work with McSweeney. I'm going to read the recommendation, and then I'll give councillors one last time to ask questions or concerns. I have a recommendation that the Council of the Township of Center Wellington authorize a contract extension to McSweeney and Associates Consulting, Inc. for the purposes of preparing a business park strategy. I have a mover for that recommendation. Councillor Dunsmore, seconded by Councillor McCrae. Any last comments or questions about this? Councillor Foster?
Thank you, Mayor. My question's for Don, Valerie. Don, you mentioned tweaking or otherwise limiting the scope of this work. What do you hope to see with what work exactly do you hope to see that will help us as a community and help the business person who might be interested in land? What do you hope to see out of this, Don, from a business person's perspective?
Yeah, from a business person's, like I'm one that just likes to get things done. So just for instance, design of infrastructure and servicing, I think your township engineers can do that quite well all by themselves. I don't know that you have to have a planner tell you outside of the lot size, this maybe the general shape of it. But outside of that, it's an engineering exercise. So that's one thing that could be looked at to make sure that we've got all the ducks in a row, that when this is done, we can come back to you, to council, and, maybe move on to the next step.
Councillor Van Leeuwen?
Sorry. Yeah, I think one of the things we need to remember is the township's not a professional in marketing, so that's one of the things we want to ensure we get right to get out to the community. Things like location analysis is something that we've already done before we bought the land. So those are some of the things you would mark off, but then there's areas of weakness that we have as well. So that's kind of what our main goal is to do.
Councillor McSweeney?
Just one question. What's the time frame we're looking at here for this